With the shortage of physicians taking center stage at a national level, medical schools have the daunting task of addressing policies and processes aimed at recruiting outstanding students. While recruitment efforts and expanded class sizes are beginning to address the shortage, the investment in faculty development to support the medical students and residents is variable. With approximately 121,000 residents and fellows, 75,000 medical students, and over 9,000 hospitals and clinics in the mix, learners experience both good and bad teaching. While several academic medical centers offer strong faculty development options, many physicians are on their own to decide how to incorporate learners into their practice, especially in areas that are far removed from teaching hospitals. Also, many physicians have not been trained as educators and often rely on the way they were taught to teach the next generation of doctors. Advancing Clinical Teachers was born out of an idea that utilizes the coaching model to design and deliver a faculty development program that matches residents and clinical faculty with training opportunities specifically customized to expand both their current understanding and assumptions about effective clinical teaching in order to make them better educators. The team developing the program is currently validating a self-assessment tool that will pinpoint an individual educator's strengths and deficiencies. Based on personal responses to the self-assessment items, the clinical educator will be directed to resources and modules aimed at meeting their specific teaching needs. The survey and portal are designed to facilitate a space where educators can develop at their own pace without judgment from supervisors. This is where we can use Canvas's help. Using an open platform to distribute the program and a well-known medical education repository to further market it, our vision is to deliver a robust, attention-grabbing, relevant, social media-enabled website that allows clinical educators to build confidence in their abilities to deliver high-quality instruction. While our program staff has content expertise related to clinical teaching topics, we'd like to explore e-possibilities as an avenue for increasing accessibility to clinical educators at local, regional, and national levels. After completing the self-assessment tool, clinical educators at all levels will be thrust into a web-based portal that encourages them to develop their skills while networking and learning from others in the web-based community. We hope to offer CME credit in order to further incentivize faculty participation and interest. What are some of the modules proposed for this new portal? The team has drafted several topics to be finalized as the self-assessment tool is validated. They include setting expectations, assessing your learner, providing effective feedback, clinical teaching on the fly using small techniques that make a big impact, designing a clinical learning encounter, top 10 professionalism mishaps, dealing with a difficult learning situation, facilitating clinical reasoning, and creating a positive learning environment. Our clinical faculty vetted the topics and have contributed case studies and common clinical scenarios for use in the module. We've identified a need within our own medical community and have already planted seeds to ensure this modality will be accepted by the clinical educators in the Central Florida region. Beyond this area, we've identified interest in our broader medical education community. By participating in groups like the Association of American Medical Colleges and the Accrediting Council for Graduate Medical Education, there is nothing quite like this program. Clinical teacher development designed with the individual teacher in mind.